Let's face it, swimming is considered to be one of the healthiest sports to do, but we can also see and argue that there are high levels of cases regarding shoulder pain. Some swimmers are only feeling pain while swimming and exercising, while others are actually in pain in bed at night when they're sleeping. And there is no one definite answer or immediate fix to these issues, but I would argue that the majority of these issues stems from weakness around the shoulder blades in combination of muscles overworking to tighten up, then causing them to pull on certain nerves around the shoulder joint and the scapula to then be perceived as pain. And when we are in pain, we're definitely not generating as much power as we potentially could. There are swimmers that are either hypermobile, they need to stabilize and learn how to engage important muscles, or we have swimmers that are tight and limited in range of motion. They need to mobilize a little bit more with movement and also with foam rolls and mobility balls. Most shoulder injuries are chronic. Chronic meaning that injuries are lasting for more than 2 weeks or so. But many of them can be fixed by proper dryland training and also self-myofascial release. And my tip is to learn how to properly use the shoulder blades. They are one of the most complex areas of the body and most vital one for swimmers. They protract, they retract, they elevate, they depress, they upward rotate, and they downward rotate. Swimmers are predominantly limited in upward rotated position, so strengthening the lower trapezius will help facilitate this movement a lot. And this will improve the streamline and make the butterfly recovery much smoother. Additionally, be sure that these muscles are functioning properly and able to help the shoulder blades in the overhead position. If you have any pain for weeks with no signs of improvement, then go and see a physical therapist quickly. If you have a foam roll or a mobility ball, target the posterior deltoid and the teres minor muscles behind the shoulders. These guys tend to get very tense and pull on nerves. Pain is often felt then on the front side of the shoulder as a little pinch. Adding on to this, the pectoralis minor muscle has been shown in research to actually be a little bit shorter in swimmers that have shoulder pain. So stretch and open up, mobilize, use the tools necessary. And lastly, the lower trapezius. You can get a peanut ball for the peanut sit-ups and movements into the streamline to feel that the muscles that are contracting, then engaging in the desired overhead position, and then we're relaxing in that position. When using these tools to mobilize, you have to, 1, be warmed up. You have to, 2, make sure that you are contracting and relaxing in the end ranges to get the best possible adaptations. Remember, movement is key, and the spots that feel the most tender, spend extra time there, give it some extra love. If you want your own peanut ball, you can order that on swimmerstrength.com on our website. And next week, we'll talk about the most appropriate time to start adding weight in the weight room. Thank you so much for watching.